Let's see what's out there. Engage. Engage.
I've lost contact, sir.
What? Engage.
This year's conference theme is collaborations and innovations to engage patients and elevate care. There's a word in there that I obsess about and that I ask you, invite you to obsess about as well. Engage. Engage patients and elevate care. Because as it turns out, if we can engage patients, anything's possible. And if we can't, it's going to be difficult to elevate care. Now, over the years, there's been an accumulation of stuff, confusing stuff. There's an E that has crept up everywhere. E-business, e-commerce, e-medicine, e-health, enough, right? The real E to focus on, the only one worth focusing on, is engagement. It's about affecting positive change. It's about activating people and groups. And the real E of engagement is really about everyone. The patient, sure. The student, the consumer, the employee. Let's spend 15 minutes to figure out exactly why and how people engage. That seems to me to be a worthwhile thing to do. But first, there's been a lot of talk about engagement over the past decade in health. And there's a lot of conventional wisdom, and I just want to put some of it to bed right now. We hear everywhere that gamification is the secret to engagement. It's not that simple. Game mechanics, when woven together with other effects, as you'll see in a minute, do have an important role. But just adding a point system or a badges system to a website, to a patient-facing solution, isn't going to engage anybody. And a lot of people have learned that the hard way. It's not that superficial. We hear everywhere that social is the magic elixir to engagement. If you make your patient-facing system social, people will engage and they'll engage forever. It's not that easy. Just adding a news feed or a Facebook page, imagining for a moment that either of those were appropriate for a health site, that's not going to create engagement. Collaboration is absolutely key, and it deserves to be part of the headline of the conference theme. But we need to understand exactly how to tap into that collaboration, and that's one of the things I want to talk to you about today. Of course, we can pay people to engage. If only it was this simple, we would be doing it. Because in a lot of cases, it makes sense to just pay people to engage. They're at risk. But studies show that monetary prizes don't have a lasting effect. And they set a difficult precedent. And mobile causes engagement. Just because something is ubiquitous doesn't mean it's going to engage anyone. Doing things in the real world and having the ability to engage from a mobile place, that's very important. But a mobile app isn't going to create engagement in of itself. Lots of people have learned this lesson the hard way, as have I. So, today I'm going to take you through the 4 essential elements of engagement. I promise you, if you use these elements together, if you obsess about engagement as you're using these elements in your patient-facing sites, guarantee you will get engagement. I just hope that's what you want, because you're going to get it, right? To make this memorable and fun, I'm going to use 4 mascots, okay? The first is the baboon. I know you're all wondering, who is this guy, a baboon? Give me a moment. The next is an artichoke. Well, at least it's a green vegetable, right? And very high in antioxidants. Then the sun. It's late October. I think we could use a little bit more of this. And last, the 4th mascot is this tiny but very, very powerful, the ant. So these will represent the 4 essential elements of engagement that I'll take you through. And I will briefly touch upon 2 case studies to illustrate these essential elements. The first is Kias, an employee wellness solution sold to HR and rolled out in self-insured employers. And the second is Catch, which you've heard about briefly here today, which is a research program spun out of Mass General under the leadership of Dr. Ausiello. Okay. So the first case study is Kias. You can check it out at kias.com. I co-founded Kias in 2008, and it has been an amazing journey. We engage employees to reduce their risk to their employers and to improve healthy habits and productivity. We became obsessed with engagement because we had to. If we couldn't engage an employee, we were worthless to our customer, the employer. And one of the reasons I'm so excited to be here with you today is that it took us years to figure out how to engage people. We were technologists. We were computer scientists. We were hackers. We were gamers. We were a lot of things. And I'm going to tell you something that you'll find shocking. Engagement is more about psychology than it is about technology. And I'm a technologist saying this. So what I'm going to do is tell you the secrets, the 4 essential elements that took us years of trial and error and millions of dollars of investment to figure out. How does that sound? Does that sound good? No? Okay. Now, when you engage employees in a wellness program, you're getting them involved in a social game to develop healthy habits. Now, social game in the sense of an extrinsic experience, where you're doing things in the real world. You're forming a team and you're doing things in the real world. And when employees engage, these wellness programs work. They're effective. You can see some of the stats here, both subjective and objective. Also, in addition, another total economic impact, the approximately 50% reduction in annual insurance premium growth that the employers experience within the first few years. So engaging programs work, whether they're for wellness or for health. Now, you've heard a couple of keywords, wellness programs, social game. So some of you are thinking, this is for teenagers and people in their 20s, right? No. Here's data over a year, many programs, many employers across the country. All ages engaged. These bar charts I'm showing you are percent active of registered. Some of you are thinking, social game, that's about competition. It's more about men. Again, wrong. Competition is not an essential element, and women engage just as much as men, as you can see here. In fact, approximately 60% of Zynga Farmville social gamers are women. Now, most importantly, I know many here, and I know I felt this way when I first started obsessing about engagement, that wellness programs and these kinds of engaging programs were for fit people and for marathon runners. And this is the most important bar chart of all. This is across over 100,000 employees. We are actually engaging the higher body mass index types more. We're not doing this for marathoners. We're not working 80 hours a week for marathon runners. They don't need us. We're doing this for people at risk. We're engaging people at risk. And every single at-risk person we engage makes it worthwhile. Now, mobile access is important, and this shows the breakdown of mobile, the various access points, and obviously very important. But mobile itself is not an essential element. It's a conduit to engagement. Now, one more point about the genders. They both engage just as much, but what they do in the engagement is different. And thanks to text analytics company Luminoso, we were able to analyze millions of social feeds, social posts on the news feed, and discern that men and women socialized about different things. So that's neat. Okay, so let's get into it now. If these demographics didn't drive engagement, none of those demographics drove engagement. And I could have put up other data up there like income, ethnicity, marital status. None of those things drive engagement. What does? And now we come to our first mascot, the baboon. The number one factor, the number one determinant of a person engaging in a wellness program is whether or not they were on a team. Whether or not they were on a team. What are we? We are primates, right? Like the baboon. Dr. Robert Sapolsky, many years ago, studied baboons in the wild. He studied the effects of stress on their health. And he studied primate social behavior. In baboons, these groups are called troops. And he studied how these groups form, how the leadership structures develop. He studied the competition, the support structures. Effectively, he studied the teams. He got into the elemental aspects of primate social behavior. Notice we're not saying social in the grand scheme of things, like Facebook. We're talking about groups of primates, groups of people, groups of patients and their caregivers. So the first essential element is the social fabric of the primate brain and how people group together. It is so powerful. It's inescapable. If you can get patients to group together, you can create engagement. It's one essential element. There's a reason why they call it teamwork. Teams work across, again, over 100,000 employees, across hundreds of employers, across all different places in the world, not just the US. The teams that were full, and in this case, in the Kia's case, 6 players, consistently overperformed, overengaged. They had the highest number of points per employee. There's never been a case where we've done a rollout and a malformed or empty team, a team of 1 person, outperformed over time. Teamwork, teamwork, teamwork. So teams is the first essential element. Get patients to group together. Okay, here we have our second essential element and our mascot, the ant. And here is B.J. Fogg from Stanford. By the way, this is, again, psychology. B.J. Fogg has this big idea he calls tiny habits. He's using the word tiny very deliberately. He inspires us to make sure we're taking small, tiny steps in habit formation, always. And the basic idea makes sense. If you take a sedentary person and you give them prizes and social and games and mobile experiences and all that to run a 10K, they're not going to do it. It's too big of a step. We need to take tiny, tiny steps. Now, at conferences like this, and in general, talking about health in cities like Boston, New York, San Francisco, we take health information for granted, don't we? We take it for granted. In most cases, people need to identify green leafy vegetables. Tiny steps. What is kale? That's a tiny step, but it's important. What is a green vegetable? That sounds outrageous, but in most parts of the country, this is the kind of step we need to take. Or oatmeal versus Krispy Kreme. Or walk for 5 minutes a few times a week. The ant. Now, these small steps add up over time, naturally. And they amplify socially. This is very important. You're combining 2 effects here. The social fabric of primates and these tiny steps. They're amplified socially because when a person sees another person on their team doing something, taking a small step, it becomes contagious throughout the team. Think about it. This happens all the time, all around us. And this contagion happens across groups, in fact. And these things add up to have great positive change. So our ant, our second essential element of small steps is very, very, very powerful. Now, Catch, and Stanley's mentioned Catch a couple times. Very, very ambitious program, and I've had the honor of being an advisor to Dr. Ausiello on this, on the subject of engagement. Catch aims to change patient care from episodic and reactive to continuous and proactive. This is very ambitious. And doing this by looking at quantitative phenotyping, measuring longitudinal data, sharing that data, and creating new models for patient care. In order to do this, we have to engage the patient. Now, each Catch program revolves around a disease profile. So each Catch program has some uniqueness to it. We envision a layered approach, and we're getting to our third essential element. There are 3 layers of patient engagement. The first is passive, and you'll have specialty devices and existing devices that make sense for that disease profile. The second layer is what we're calling the utilitarian layer, which is often overlooked. You have patients that are performing some utility on their own behalf, refilling a prescription, scheduling an appointment online. We want to take that opportunity to capture additional data, okay? And the third layer, and the trickiest to achieve, is the engagement layer, that is the active layer. And here we look at each disease profile, and we figure out how do those patients and their caregivers form groups. And once they form group, how do we tap that primate social brain element in order to engage them? And then what small steps can we take to help them? And what kind of unfolding experience can we project? And this is our artichoke, one of my favorites, the layer upon layers as an experience. Now, this is easier said than done. This is itself elemental. You cannot engage anyone over time with a static, one-dimensional experience. It's guaranteed not to engage them over time, maybe for a day, a week. People need, and patients need, an unfolding experience that presents them with new things, new challenges, and new kinds of reinforcement over time. This is a lot of work, but it is the key. It is the essential element for engaging over time. And we must engage over time. We can't just engage for 2 days or 2 weeks. We have to engage over a period of time. So it's our third essential element, are these unfolding layers. But as a technologist, I recognize this is difficult to pull off in patient-facing systems, in software, for example. So we look at gameplay, where this has always been understood. Gameplay always has the notion of unlocking levels in order to engage people over time, opening up new quests through the collection of badges and points. It's always been understood. The secret is this. Look at your patient-facing system. It's actually quite simple, in a way. And ask yourself, does it evolve around the E of engagement? Because if it can evolve around the E of engagement, you're guaranteed, it's only a matter of time and effort, to engage patients. Run A/B testing to see what features engage more, what features engage less. But if that's not easy enough, let me give you the easiest possible way of approaching this with your patient-facing systems. Measure engagement over time. So engagement is a login or any kind of activity by the patient. And look at the engagement graph. If it looks like this, and I saw graphs like this for years, for years, okay? And I knew we were failing to engage. This one is abandonment level over time, by the way, just as bad. We're not engaging here. Full stop. These kinds of graphs for an engagement graph, your patient-facing system must be evolving based on something else, okay? And engagement isn't it. What we need to do is obsess over engagement and see graphs like these. Okay? Now, an important point, I get asked about engagement all the time, and you can't engage 100% of the patients. We're not trying to engage 100% of anybody, ever. If we can engage half or a third of the people at risk, within the first year of evolving our systems around engagement, that's an enormous accomplishment. If we can engage half of the at-risk employees within an employer and have them develop healthy habits over 3 months, that's a tremendous achievement. We have a loyal customer. Okay. The fourth essential element. And Aesop's fable of the sun. And this is a children's tale, and I like it. It serves us well. As the story goes, the wind wants to prove its power to the sun. And it argues that it can blow a coat off of a man in the park by blowing hard on it. And of course, the harder it blows, the tighter the man clutches his coat. And the wind fails. And of course, this is a children's fable. The sun achieves this very, very easily by shining brightly. The essential element is positivity. Always be positive, reinforcement, encouragement, and reinforce those doing the encouragement. Positivity is transformative and is the fourth essential element. So to wrap up, the four essential elements of engagement: the power of primate social behavior in groups or teams, the layering of an unfolding experience to engage over time, tiny, small steps in habit formation, always, and by our standards, really, really tiny, and positive and fun like the sun. And remember, the E in eHealth is engagement. Thank you.